This is Dr. James, and today what we're going to talk about is napping in kids. Now, when a newborn comes around, they're kind of always in and out of consciousness. They average about 16 to 20 hours a day, and they're usually waking up to eat, pee, poop, things like that. They're not really interacting. Around the time they're a month old, then they start to kind of wake up and they start to develop personalities. And this is when they'll start to space out their time, where they're awake for longer periods of time, and then they may take naps for longer periods of time. Around the time they're 2 months old, they get where they can sleep longer periods at night. And then during the day, they're awake for longer periods, and they start to maybe have 2, maybe 3 longer naps. Then these naps will start to coalesce as well, so they may only have 1 or 2 naps a day. The important thing to remember is that this varies baby to baby. Some babies like to take lots of naps. Some babies like to take long naps. Some babies like to take short naps. If you want to guarantee when your baby takes a nap and for how long, the important thing is scheduling, where they're doing the same activities and you're doing the same thing every day. But let's be honest, that's really, really hard. A lot of things come into play. You may have other kids. You may have a job. They may be at daycare. There may be other children around. There may be lots of distractions. There may be different doctor's appointments, things that can throw this schedule awry. If that happens, well, then their naps will be kind of out of schedule as well. So just remember, if you want it to be scheduled, well, you're going to have to be on a schedule. But otherwise, if your baby's doing well, regardless of how many naps they're taking or how long they're taking their naps, it's actually normal. You can't put the babies in a box and make them take a nap for a certain period of time. And what's right for one baby may be not right for the next one.